Shoulder flexion range of motion. Shoulder flexion range of motion is tested with the client laying supine on the mat table, with arms extended down by their side. The axis of rotation is at the greater tubercle of the humerus. The stationary arm is placed parallel to the thorax, and the mobile arm is down the midline of the humerus. The normal range of motion for shoulder flexion is 180 degrees. Specifically shown in this video, this client received 180 degrees shoulder flexion. Hip abduction range of motion. Hip abduction range of motion is tested with the client laying supine on the mat table with both legs extended in neutral position. Have the client abduct their lower leg. The axis of rotation is over the anterior superior iliac spine. The stationary arm is placed along an imaginary horizontal line that extends from one ASIS to the other, and the mobile arm is aligned with the midline of the femur. Normal range of motion of hip abduction is 45 degrees. Specifically shown in this video, the client received 40 degrees. Thoracolumbar side bending with a goniometer. Thoracolumbar side bending with a goniometer is tested with client standing with feet shoulder width apart, legs straight, and with arms extended by their side. The axis of rotation is aligned with the spinous process of S2 by palpating the anterior superior iliac spine and moving medially. The stationary arm is perpendicular to the ground, and the mobile arm is aligned with the spinous process of C7. Normal range of motion is 25 degrees thoracolumbar side bending. Specifically shown in this video, the client receives 26 degrees side bending to the left and 28 degrees side bending to the right. Upper trapezius manual muscle testing. Upper trapezius is tested with the client sitting on the side of the mat table. Stand behind the client with both hands on top of their shoulders. Instruct them to shrug their shoulders. Assess range of motion by resisting in a downward direction. This motion occurs in the frontal plane. The origin of the upper trapezius is the external occipital protuberance, spinous process of C7. The insertion is the acromion process of the scapula, and the actions of the upper traps is the cervical extension, lateral flexion and rotation, and scapular elevation. Specifically in this video, the client received a 5 on a 5-point grading scale. Gastrocnemius manual muscle testing. The gastrocnemius is tested with client standing with knees straight in a neutral position. Instruct patient to lift their heels off the ground going through full plantar flexion range of motion. Observe how many consecutive heel raises they can do. This motion occurs in the sagittal plane. The origin of the gastrocnemius is just superior to medial and lateral femoral condyles. The insertion is the calcaneus. The action of the gastrocnemius is knee flexion and ankle plantar flexion. A grade 5 is given for 25 heel raises, a grade 4 is given for 10 to 24 heel raises, and a grade 3 is given for 1 to 9 heel raises. Specifically in this video, the client performed 25 consecutive heel raises, giving them a grade 5. Rectus abdominis manual muscle testing. The rectus abdominis is tested with client laying supine on the mat table with legs extended and arms behind the head. Instruct the client to curl up as far as they can go. This motion occurs in the sagittal plane. The origin of the rectus abdominis is the pubic crest and the pubic symphysis. The insertion is the xiphoid process, cartilages of ribs 5 through 7, and the action of the rectus abdominis is flexion of the trunk. A grade 5 is given if the inferior angles of the scapula clear the mat and hands are behind the head. A grade 4 is given if the scapula clears the mat but has to cross their arms in front of their chest. A grade 3 is given if the scapula clears the mat but can only be performed with arms extended by their side. Specifically in this video, the client scapula clears the mat with arms behind the head, receiving a grade 5.